Diabetes is a chronic disease that occurs when the pancreas is no longer able to make insulin, or when the body cannot make good use of the insulin it produces. Insulin is a hormone made by the pancreas that acts like a key to let glucose from the food we eat pass from the bloodstream into the cells of the body to produce energy. All carbohydrate foods are broken down into glucose in the blood. Insulin helps glucose get into those cells. Not being able to produce insulin or use it effectively leads to raised blood sugar levels in the blood, known as hyperglycemia. Over the long term, high glucose levels are associated with damage to the body and failure of various organs and tissues. Having too much insulin or using it ineffectively can also cause blood sugars to become too low. This is called hypoglycemia, which leaves our body without the basic level of sugar and energy our cells need to thrive. There are 3 types of diabetes. Type 1 diabetes can occur at any age, but it occurs most frequently in children and adolescents. When you have type 1 diabetes, your body produces very little or no insulin, which means that you need daily insulin injections to maintain blood glucose levels under control. Type 2 diabetes is more common in adults and accounts for around 90% of all diabetes cases. When you have type 2 diabetes, your body does not make good use of the insulin that it produces. The cornerstone of type 2 diabetes treatment is a healthy lifestyle, including increased physical activity and a healthy diet. However, over time, most people with type 2 diabetes will require oral drugs and/or insulin to keep their blood glucose levels under control. Gestational diabetes is a type of diabetes that consists of high blood glucose during pregnancy and is associated with complications to both the mother and the child. Gestational diabetes usually disappears after pregnancy, but women affected and their children are at an increased risk of developing type 2 diabetes later in life. Individuals with type 1 diabetes must be treated with insulin, as the cells in their pancreas no longer produce it. Insulin plays a vital role in glucose uptake and is required by the muscle and fatty tissue. However, insulin is not solely for individuals with type 1 diabetes. Those with type 2 diabetes may also be placed on insulin, but generally only after failing to achieve healthy blood sugar levels with oral medications. Individuals with diabetes typically receive multiple injections per day, including bolus insulin administered before meals and long-acting insulin that lowers blood sugar levels over time. Insulin is classified as a high-risk medication because it can cause individuals to experience hypoglycemia, but the benefits of this treatment surely outweigh the risks. Blood sugar testing provides useful information for diabetes management. It can help you monitor the effect of diabetes medications on blood sugar levels, identify blood sugar levels that are too high or too low, track your progress in reaching your overall treatment goals, learn how diet and exercise affect blood sugar levels, and understand how other factors such as illness or stress affect blood sugar levels. Healthcare providers will let you know how often to check blood sugar levels. The frequency of testing usually depends on the type of diabetes you have and the treatment plan. There are multiple brands of glucose monitors and test strips, so be sure to read the instruction manual to become familiar with your individual's make and model. But they all utilize the same basic mechanics. After washing your hands, insert a test strip into your meter. Using a lancing device on the side of the individual's fingertip to get a drop of blood by squeezing the base of their finger. Touch and hold the edge of the test strip to the drop of blood and wait for the result. Your blood glucose level will appear on the meter's display. Record the results on the individual's MAR. Insulin syringes come in different sizes depending on the dose of insulin someone may need. Your individual's diabetes care provider or pharmacist will help find the right size syringe. Use the correct size insulin syringe to ensure that we are getting the right dose of insulin. Most insulin comes within a pre-filled pen-shaped syringe with removable cap needles. You can inject insulin into someone's abdomen, upper arm, buttocks, hip, or the front or side of the thigh. Insulin works fastest when it is injected into the abdomen. Do not inject insulin within 2 inches of the belly button or into any stretch marks. Do not inject insulin into areas where you have a wound or a bruise. Insulin injected into wounds or bruises may not get into the body correctly. Do not inject insulin through clothes. Injecting through clothes can contaminate the needle and may cause an infection. Use a different area within the site each time you inject insulin. For example, inject insulin into different areas of their abdomen. Insulin injected into the same area can cause lumps, swelling, or thickened skin. The proper procedure for insulin administration. Perform hand hygiene with soap and water. This will ensure prevention of any type of an infection. Dry your hands with a clean towel or a paper towel. Glove use is vital for both blood glucose checks and insulin administration due to the high risk of blood contact. Refer to our bloodborne pathogens plan in the Procedures and Policies Manual, approximately page 236. Clean the skin where you will inject the insulin. You can use an alcohol pad or a cotton swab dipped in alcohol. Grab a fold of their skin. Gently pinch the skin and fat between your thumb and first finger. Pinch an inch. Insert the needle straight into the skin. Do not hold the syringe at an angle. Make sure the needle is all the way into the skin. You do not need to press hard. Let go of the pinched tissue. Push down on the plunger to inject the insulin. Press on the plunger until the insulin is gone. If you are using a pen needle, keep the needle in place for 10 seconds after you inject the insulin. Pull out the needle. Do not rub. This will keep insulin from leaking out. Throw away the used insulin syringe and needle into a sharps container. Never recap the syringe before you throw it away or utilize the one-handed sweep motion. In order for you to be able to practice this skill on our individuals, you must first receive an in-person safety checkoff by a registered nurse. Sometimes those who have diabetes may have a diabetic emergency, where their blood sugar level becomes too high or too low. Both conditions could be serious and may need treatment in a hospital. What are the signs and symptoms of a diabetic emergency? Hunger, clammy skin, profuse sweating, extreme thirst, drowsiness or confusion, weakness or feeling faint, sweet-smelling breath, and a sudden loss of responsiveness. If you suspect an emergency, the first aid treatment is the same for both hyper and hypoglycemia. If able, check the blood glucose levels. Give the individual sugar to eat, cola, juice, candy, milk. If they don't feel better after 5 minutes from receiving the sugar or are unresponsive, seek medical attention immediately.